In anatomy, Professor Adams taught us about all the muscles and where they originate from. She also taught us about insertion, agonist, antagonist, and synergist. There are 5 joint movements that I will be demonstrating while jump roping as well. They include elbow extension, elbow flexion, shoulder internal rotation, plantar flexion, knee flexion. First, I will use elbow extension, which is this, to pick up my jump rope. First, I will use elbow extension, which is this, to pick up my jump rope. The tricep long head, medial head, and lateral head are all agonist muscles of elbow extension. The long head originates from the tubercle inferior to the glenoid fossa of the scapula. The long head originates at the tubercle of the glenoid fossa of the scapula, and the short head originates at the coracoid process of the scapula. They both insert at the radial tuberosity of the ulna. Elbow extension is a sagittal plane of motion. Since we are using the same joint but reversing the motion, the muscles will stay the same, but the antagonist and the agonist will switch. Now the tricep muscles are the antagonists and the biceps are the agonists. Brachiocordalis and brachialis are the synergists. Brachiocordalis originates from the lateral suprachondral ridge of the humerus and inserts at the base of the styloid process of the radius. The brachialis originates from the distal anterior shaft of the humerus and inserts at the ulna, tuberosity / coracoid process of the elbow flexion is a sagittal plane of motion. Now we will experience shoulder internal rotation. The subscapularis is the agonist and it originates from the subscapular fossa of the scapula. It inserts at the lesser tubercle of the humerus. The infraspinatus is the antagonist and it originates from the infraspinosus fossa of the scapula and inserts at the greater tubercle of the humerus. The deltoid is the synergist and it originates at the acromial end of the clavicle anterior, acromial process of the scapula lateral, the spine of the scapula posterior. It inserts at the deltoid tuberosity of the humerus. Shoulder internal rotation is a transverse plane of motion. Now we will demonstrate knee flexion. The bicep femoris long head and short head, semimembrananeous, and the semitendinous are all agonists. The long head originates from the ischial tuberosity of the ischium, os coxa, and the short head originates from the linear aspera of the femur. They both insert at the head of the femur, lateral condyle of the tibia. The quadriceps, including vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris, are all antagonists. The vastus lateralis originates from greater trochanter and linear aspera of the femur. The vastus medialis originates from the linear aspera of the femur. The vastus intermedius originates from the anterior lateral surface of the femur, and the rectus femoris originates from the anterior inferior iliac spine of the ilium / os coxa. All quads insert at the patella and tibial tuberosity of the via patellar tendon ligament. Popliteus, gastrocnemius, gracilis, and sartorius are all synergists. The popliteus originates from the lateral condyle of the femur and inserts at the proximal tibia. Gastrocnemius originates from the lateral and medial side of the medial condyles of the femur, inserts at the calcaneus via Achilles tendon. The gracilis originates from the body of the inferior ramus of pubis, os coxa, and inserts at the medial shaft of the tibia. The sartorius originates at the anterior superior iliac spine of the ilium and os coxa, and inserts at the medial shaft of the tibia. Knee flexion is a sagittal plane of motion. Finally, we need to plantar flex our foot like so. The soleus and the gastrocnemius are both agonists. The soleus originates from the head of the fibula, medial board of the tibia, and the gastrocnemius originates from the medial and lateral condyle of the femur. They both insert at the calcaneus via the Achilles tendon. tibialis anterior, extensor digitorum longus, and the extensor digitoris longus are both antagonists. The tibialis anterior originates from the lateral condyle / body of the tibia and interosseous membrane. It inserts at metatarsal 1 and medial cuneiform. The extensor digitoris longus originates from the lateral condyle of the tibia, body of the fibula, and the interosseous membrane. It inserts at the medial and distal end of the phalanges. Fibularis longus, fibularis brevis, tibialis posterior, flexor digitoris longus are all synergists. The fibularis longus originates from the head / body of the fibula and inserts at the metatarsal 1 / medial cuneiform. The fibularis brevis originates from the fibula and inserts at the base of the metatarsal 5. Tibialis posteriorus originates from the tibia, fibula, and interosseous membrane. It inserts at metatarsals 2 through 5, navicular, cuneiforms, and cuboid. Flexor digitoris longus originates from the posterior tibia and inserts at the phalanges of the toes. Plantar flexion is a sagittal plane of motion. Now I will demonstrate jumping rope with all of those motions put together. Great! Jumping rope is a great way to use all of the muscles I just mentioned. Now that we learned much more about the muscles used, I feel much more prepared for the exam.